Hello, welcome to the JCL 2021 International Conference. My name is Lucille Aguila-Abraham. I'm a graduate from the University of Santo Tomas with a degree of Doctor of Philosophy, major in Commerce. My presentation is entitled Ethical Standards or Issues. Are they relevant to quality patient care? Before I start with my presentation, I would like to say that this study does not reflect the views of the hospital where I hold office, but it has the same views as the university where I graduated from. My research objective is to determine if ethical standards or issues are relevant to quality patient care. In order to proceed, we have to understand the meaning of ethics, which is a part of philosophy that studies the morality of human action. It considers human acts, whether good or bad. In relation to ethics and the healthcare professional, all men and women have the natural moral law, which enables them to do good and avoid evil. For this reason, a healthcare professional has to be always in favor of life. In relation to quality patient care, the ethical attitude is to defend life. The point of view of the patient is important in assessing and improving care, which depend on the interaction with the healthcare providers. The sole purpose of the medical profession is to protect human life. There are numerous threats on human life in various stages, like in the unborn, the dying, and in occasions of violence. Human life is sacred from the beginning when it was created by God. Life is essential. No person has the right to take his own life. No state or society has the right to take the life of another. The fundamental principles are the right to life as a fundamental human principle and the respect for the dignity of the human person. The first ethical issue is abortion, which is the termination of pregnancy before the 28th week of gestation when survival outside the womb is almost impossible. Human life must be respected and defended totally from conception. By the time an unborn child is 18 days, a baby's heart beats. At 42 days, the brain waves are detected. At 52 days, there are hiccups and yawns. At 8 weeks, all organs function. At 9 weeks, the baby has fingerprints. At 10 weeks, the baby can feel pain. At 12 weeks, the baby can smile. So this was taken from the heart of a shepherd by Pastor Travis Smith. He is not a Catholic, but he is pro-life. The right to life of a human being necessarily begins from the unborn child. So the embryo is an unborn human being. The second ethical issue is contraception. The reference is the Science Facts on Contraceptives by Dr. Raul Nidoy. Number 1, the pill and IUD cause the death of babies. When does human life begin? At fertilization, when the sperm penetrates the egg. Do birth control pills and the IUD fatally harm the embryo or the young human being? Yes. Number 2, the pill seriously harms women's health. Is the pill safe? No. It causes cancer like breast cancer, stroke, heart attacks. However, the natural way of regulating births has no side effects. It is 99% effective. The use of contraceptives threatens the family. It causes the downgrade of marriage, more extramarital affairs, more premarital sex, more fatherless children, more single mothers, more abortions. Contraceptive use results to greater poverty. It leads to the decline of marriage, less domesticated men, more crimes, more social pathology, and thus more poverty. But isn't population control connected with economic development? No. Population growth is beneficial. Condom use leads to the spread of AIDS. Will the use of condoms decrease the rate of HIV/AIDS? It will increase it because it makes people take greater sexual risk, thus worsening the spread of AIDS. So what's the best solution to the problem? Fidelity and abstinence. Although NFP and contraception have the same goals, the first is non-procreative, while the latter is anti-procreative. The third ethical issue is euthanasia. All doctors have the primordial principle of doing no harm. The WMA said that physician-assisted suicide, like euthanasia, is unethical and must be condemned. An act or omission directed to this goal constitutes murder, is seriously against the dignity of the person, and is against God. It can be lawful to discontinue treatment which are very painful or extraordinary. However, the ordinary care of a patient cannot be stopped although death is imminent. Palliative care is to be encouraged. The fourth ethical issue is family life. The family is the foremost natural society with rights that belong to it, and it is most important in relation to social life. This is a descriptive study, and the following statistical tools were used to determine the relationship between palliative patient care as dependent variable and ethical standards or issues as independent variable. The subject and study sites are the 5 Level 3 local government hospitals with the following respondents. The questionnaire was formulated based on the following resources. It was subjected to Cronbach's alpha mean to validate its reliability through pre-testing in 2 government and private hospitals. The questionnaire had 2 parts, the statements and demographics. A total of 240 respondents were included in the research study, equally distributed among the medical practitioners, nurses, chiefs, hospital officers. For the survey results, abortion is morally not acceptable with an overall remark of strongly agree. I am not in favor of contraception with a general answer of agree. Euthanasia is morally not acceptable with an overall remark also of strongly agree. I believe in the sanctity or holiness of family life with a general answer of strongly agree. Summarily, the respondents replied to strongly agree in relation to abortion being not morally acceptable. There's the belief in the sanctity of family life. Euthanasia is morally not acceptable. But the overall remark of agree can be seen in contraception being morally not acceptable. For the discussion, abortion is morally not acceptable, strongly agree. Human life begins at conception. To seriously harm that human life is a very grave injustice. If it comes to existence due to a grave offense or a wrong action, then the answer is to penalize the perpetrator of the crime and not kill the blameless, defenseless human life. If that human life is unwanted, then the solution is to give up the baby for adoption. Contraception is morally not acceptable with an overall remark of agree. It is not 100% effective. Since that human life is unwanted, the couple will either keep the baby or resort to abortion. Contraceptives also has abortifacient effects. It can seriously harm the health of the woman. It can lead to the breakdown of marriage. It can increase the spread of HIV/AIDS. So what is the right component for high economic growth? It is not population control. What are the elements of economic progress? Good leadership, transparency, management by good example, stable finances, investment in infrastructure, provision of more jobs. Euthanasia is morally not acceptable with a general answer of strongly agree. It must be emphasized that extraordinary means of care may not be justified if it causes undue burden to the patient and the family, even if survival is unlikely. Ordinary means of care like food, water, exercise, and medical care can be continued, but it can be lawful to discontinue treatment that are very painful, harmful, or disproportionate to the anticipated result. To the belief in the holiness of family life, the overall remark is strongly agreed. The family is the most fundamental unit of society. If the family is damaged, that it can lead to the disintegration of society. So a healthy family leads to a strong, progressive society. So what are the solutions to the family life issues? Instead of promoting sex education, implement values education and formation. Instead of distributing contraceptives, provide livelihood programs. Instead of propagating artificial family planning, spend on infrastructure projects to create jobs. Healthcare matters require an ethical approach. Not everything that can be done should be done without regard to ethical issues. So to the question, ethical standards or issues, are they relevant to quality patient care? The answer, the healthcare professionals cannot be confined to scientific knowledge and practice, but also to ethical and moral principles which serve as a guide in making the right moral decisions and actions in order to administer quality patient care. This is consistent with the Philippine Constitution, wherein the state recognizes the sanctity of family life and shall protect and strengthen the family as a basic and autonomous social institution. It also recognizes the need to protect the life of the mother and the life of the unborn from conception. Our belief as a Catholic nation is to protect and uphold life, which is a principle of the Catholic Church. All men and women, regardless of creed, favor life. For the right to life is a fundamental human right. Thank you very much.